Hey, welcome back to the Mountain Morning Show. I'm here with Stephen Mobley, Dr. Mobley, with the Redstone Health Center here in Park City. Thanks so much for being on the show this morning.
Morning, Chelsea. Great to be here.
Yeah, we appreciate it. And I tell this to a lot of my guests, but we're hiring for a new co-host. So if you know anyone that's an amazing athlete or, you know, good on screen, like Dr. Mobley here, you could try out for the visitors. So you're my sit-in co-host for the next 10 minutes.
Just hang out here for the rest of the mornings.
That sounds cool. Well, you can be it for 10 minutes, right?
Perfect.
We'll be my co-host. We'll do that. So let's first talk a little bit about your background. You've been in Park City for about 10 years. So let's talk about your professional experience.
Yeah, so I joined the University of Utah 10 years ago this August, and so my wife and I have lived in the Park City community that long. About a year ago, the university had a larger mission to bring the surgical specialists out to the community. We don't want people to have to drive all the way down to Salt Lake for their specialty care, so there's more and more specialists in the community. So I've been at the Redstone Clinic since fall of 2011, and been growing taking some of the busier facial plastic surgery practice from Salt Lake and moving my footprint up here now.
All right, very good. And Park City, what a beautiful place. I mean, the weather's perfect right now. I'm so excited for summer, so you're in a very good place.
It's much nicer to drive 5 minutes to work than 25 minutes.
That's
I really
true.
enjoy my Redstone days. Those are some of the better days of my professional week.
Very good, cool. So let's talk about what we're going to discuss today is anti-aging, and we know that there's a big push for this. There's so many products and processes out there that say, oh, this will help you with wrinkles or help you keeping and looking younger. So kind of explain that first off, why this hype around this, of course, and then ways that we can actually prevent aging.
I think sort of one of the new trends is probably less is more. I think the overdone, operated on look, kind of your classic Joan Rivers, maybe Dolly Parton's getting there. Those sort of
Michael, do you have any photos for that?
Yeah, pulled tight as a drum faces are getting a little bit out of vogue. And one of the more interesting things that's occurring in facial beauty is we used to have a sort of a simple two-dimensional view of facial aging that was all just drooping. And so we spent decades as surgeons developing procedures that lifted and tightened, and then we get these sort of unnaturally pulled tight looking faces.
Very much so. That is true.
So now we're realizing that a youthful face, your face perhaps, Chelsea, a youthful face has more fullness, and an older face has less volume. So we're getting a little bit more away from just pulling tight and trying to revolumize faces. We can do that in the office, we can do that in the operating room. There's different ways to add volume to faces, but round cheeks, fuller faces are more signs of youth. They look more natural, and you don't have that pulled, over-operated look.
Oh, that makes me feel better because I don't really have cheekbones. I'm more round, so I'm younger, right?
That's right. Round is youth.
I'm just kidding. I wish I had higher cheekbones, but no. But yeah, that's really interesting, actually, to kind of see how that's developed. So, what are some simple things people could do too? We know, using sunscreen is a big deal.
Yeah, one of my sort of guiding philosophies, let's do creams before needles, let's do needles before scalpels. So the first thing I want to do when I meet a new patient is make sure they're doing good basic skin care. We live in one of the greatest states in the nation, lots of fun outdoor activities, bright sun.
You always want to be outside.
Most months of the year, so everyone hopefully watches this right now.
Even in the winter,
exactly.
You get so much sun up on the slopes skiing, and so there's so much.
There's actually published studies in dermatology journals that say that the reflective sun off of snow is equivalent to being on the beach of a major tropical resort.
Really?
So there's a lot of intensity from the sun here in Park City.
Wow, I didn't know it was that much the same.
Always preaching sunscreen, sunscreen, sunscreen. Everyone should be wearing sunscreen, a daily sunscreen. People who think, oh, I don't go out in the sun. But you still walk out to your mailbox, you run out to your car, you chase after your kids. Those small exposures over a lifetime can lead to skin cancer. So sunscreen's number one. After that, you want...
Oh, sorry, I had a question with that. Well,
Please.
I know that, like with my own morning regimen with washing my face, a lot of products have 15 SPF. Is 15 enough, or do you need 45?
I think if you're just going to cover that occasional out in the sun, 15 is probably just fine for a daily
that's just
use.
Daily.
Exactly.
So that's something that would work.
And you don't, as you get into the higher sunscreens, they're going to feel more cakey. If you're not going to be out in the sun sunbathing, then a 15 is probably completely adequate. If you're going to be out in the summer or out in the slopes for the day, then we want you to use something heavier. But 15 is very appropriate for just day-to-day use.
Good to know. So sorry, go on.
Well, then after your sunscreen, that's sort of the basics. Then you want to see what people are doing to sort of minimize fine lines and wrinkles. And there's more and more prescription medications which are pretty good for that. It's interesting if you watch TV commercials, all of these commercials for anti-wrinkling makeups, and really there's very little science behind them. The most science is behind...
What, they're lying to us? I had no idea.
Imagine that. There's mistruths on TV.
Gosh.
Well, the FDA doesn't regulate makeups, and so they're allowed to make larger, more boisterous claims.
Okay.
Now, the FDA does regulate prescription medications, and so if a prescription medication is going to say this helps with wrinkles, they have to have done controlled clinical studies to prove that. So some of the Retin-A products that have been out for years and years are great for fine lines and wrinkles, particularly in the eyes, forehead, mouth. Renova is more of a prescription-based anti-wrinkling medication. Those are some of the easier medications to begin on that are going to not make you look younger next week, but if you use them day after day, week after week, you'll begin to notice that you're losing fine lines and wrinkles and probably looking a little bit younger than people around you the same age.
And when it comes to products, I asked this beforehand, but New Skin? What do you have to say about them? Because their big push is anti-aging products.
There's a lot of grade of these sort of these pharmaceutical grade cosmetics. New Skin's one. In our office we carry PCA, Physician's Choice. That's another popular one. Obagi's almost become a household name. I don't think you could scientifically say that one's better than the other. Probably the most important thing, find one that you like, find one that feels good on your skin, and stick with it. But they all do similar things. No one can come out and say, we are the best, because that study probably couldn't be done and scientifically valid.
Okay, good to know. And then let's talk more about some advancements in facial rejuvenation. You kind of talked on that earlier. Is there anything else you wanted to add to that?
So we want to do, our creams before our needles, and then the next stop is going to be needles. So we can do a lot of things to slow down the aging process just with simple injectable treatments in the office. One of the most popular ones that's been out now for a long, long time is Botox or Dysport. These are muscle relaxants that are great to help with the lines around the eyebrows, forehead, crow's feet area. Very effective treatments. Going back to the volume that I mentioned earlier, Sculptra is a wonderful product. Sculptra actually stimulates your body to make its own collagen. So if you're in, the classic patient for Sculptra is probably at least past their 40th birthday, maybe into their 50s. They're getting a little bit more of a hollow face in the temples, cheekbone area, and Sculptra can begin to stimulate your body to make its own collagen to bring back a more rounded, more youthful face.
Is that something, some of these procedures, are they just like one day you go in for, like how much time does a procedure like that take? Like
these are definitely just office visits. I mean, the whole thing, check-in to check-out, is probably under an hour. If you're doing Botox or a Dysport, a muscle relaxant, you're going to want to do that about 3 to 4 times a year just to maintain it. Sculptra is done in sessions, and so a typical Sculptra patient would probably make about 3 office visits over a 2-month period to get the collagen stimulation, to get the rounder cheeks, filled out face, those types of things. So it's not just one treatment, but after 2 or 3 office visits, you're going to be pretty much where you would like to be.
Okay. And I know that there are some people, I think a small percentage, that feel like, oh, I'd like to get this done, but is it safe, completely safe?
Nothing has no risks, and particularly in plastic surgery, there's always going to be some risks.
Of course.
The goal, hopefully, for people watching is do your research and find somebody who does a lot of this stuff, not just dabbles in it. And so the main risk for these things, for example, let's say Botox, the muscle relaxant, if you treat too much, you might get a little bit of a droopy eyebrow. That may last you 6 weeks. It will go away. Sculptra has a few side effects. They're pretty uncommon. For the most part, having done many, many injections over the last several years, I've seen very few long-term problems with it. It's a good volumizer. It can be done in the office, keep you out of the operating room, and adds a very natural look to the face without the downtime of a surgical procedure.
Okay, and kind of going off what you said, going with a provider or doctor that knows what they're doing, that's been in the practice for a while, like yourself, what would you recommend to people when they're researching who to go through for? We're
pretty fortunate. I mean, for a smaller community, we actually have a lot of good providers. So one nice thing about the cosmetic world for patients is there is a competition online for recruiting new customers, if you will, new patients. And so most people can go online and research their provider. Of course, I'm biased. I like to see people who've dedicated their lives to a cosmetic surgery discipline. So when I see people in other medical specialties dabbling in cosmetics, I get concerned. Probably not the people I'd want to send my wife to. But people can do their own research. We have a diverse community of providers. My bias is to stick to people who've dedicated their careers to cosmetic surgery. Facial plastic surgeons, dermatologists, people who really practice it full-time, not just dabble in it.
And I kind of have another question with that. I've heard a lot of talk about medical spas. Like, what would you say about those? Because I've heard, are those something that's safe? I've heard sometimes doctors just kind of add those to their whole system of what they do, but they're not necessarily certified for certain things. Or what would you say about the safety of medical spas?
I think in the big picture, they're great. They're a place to go to unwind. If people have stressful lives, a spa environment is always a great way to manage your stress. We know that stress management is linked to being healthy. Now, you probably don't want the same person who might give you a pedicure to then turn on a very powerful laser and start, moving that across your face. So buyer beware a little bit.
Well, doctor, I'd be the type of patient who'd be like, wow, you're you're so talented, you can do my pedicure and my Botox. But that's not the case, yeah.
So buyer beware. Research the doctor's credentials. One of my biggest advice to people seeking medical spas: make sure that there's a medical doctor on the premises.
Okay.
And then
so that's what's
research
important.
the background of that medical doctor. If you're doing a more invasive procedure, if you're sticking more in the spa-like services, a simple facial, maybe just a simple superficial microdermabrasion of your skin, those can be safely done at the spa level. But if you're going to move into something more invasive, just do your homework, make sure the person doing it has proper credentials.
Very good. Some excellent information, especially with summer coming upon us, wanting you to be out in the sun more often. So remember that sunscreen, some great tips. So thank you so much, Dr. Mobley, for being on
Chelsea.
the show.
Appreciate your time.
Thank you. So thanks for joining us here on the Mountain Morning Show. We'll be right back after this quick break.